So this patient's coming in, he's had an inflamed cyst sort of on the location, the back of his ear, that he irritated a bit of a couple weeks ago, and then it's become progressively more swollen and inflamed. You can see how swollen is the back here. So this has become an inflamed/infected area. So we're going to have to just freeze this and just get it to drain. Again, our freezing may be a little bit compromised. Now, if we wanted to freeze this completely so he didn't feel anything, you could do a very large circumferential block with the ear. You have to go all the way around it, which is a lot of freezing, which is pretty uncomfortable. So we're going to try and just see if we can superficially freeze where we're going to be cutting into so he doesn't feel that part of things, and then evacuate this as best we can. So here we're going to use the freezing here. So we want the bevel to be up. So and you want to be very superficial. Going to feel a poke here. To feel a burning. And we want this to swell and blanch. You okay? Mm-hmm. It's a very small space, because if we're into the cyst, it swells, and then that's going to be more uncomfortable for him. Keep it good enough there. Yeah. All right, so Dr. Jane, you're up. You come on this way. You'll hear?
Yeah.
So we'll just check this first. Any pain there? All right, so she's going to use her number 11 blade. Yeah, that's what we'd expect. Yeah, just be careful. You okay? Not too uncomfortable? This is always the balance, because again, we don't have great freezing, so we want to get this to clear as best we can. So we're going to see whether we can just dissect that out. You might get lucky. So grab the pickups, yeah. See if you can.
It's a bit tethered.
Yeah, see if it's. This is where we'll find the limitations of our freezing. You okay?
Yeah.
It's a little bit friable. Just grab the scalpel for me. So obviously what we're trying to do here is take out as much of the membrane as possible. Usually when it becomes infected like this, we can't take out enough to get it to clear, but sometimes you can. Pretty clean. So we're going to irrigate that, clean that out as best we can, and then we're not going to sew this closed. We want to keep that open just because of the way it accelerated quickly and the likelihood that there's some inflammation in there. So just grab the So these, you want to just irrigate it right into it. Yeah, just squish it. So you want to squeeze it, like not like little bursts, because you're trying to dislodge irritation from around the actual walls.
So you want little bursts.
That little burst continuously, yeah. Very good. And there, if there's some extra stuff, we would see that it comes out now. Not too bad. And the other one. So what are the two indications why we pack?
To help continue drainage, and if there's any
Second one is remember, hemostasis is the second one. So if it's just bleeding, then we want to put in just overnight, because we don't do it long term, because it's just uncomfortable for the patient. But I think we'll get away without it in this particular case. So I think we'll just put a pressure dressing on this. So we'll pressure dress this up, and then we'll see this tomorrow, and that's it.